The optometrist will check the prescription stability. They'll look at if the patient has severe dry eye, if there's any early corneal changes or changes on the scans that are definite red flags and that, you're contraindicated for surgery, and just a general ocular health. Then when they see me, we go into the scans in more detail. We look for nuances. We also do a dilated assessment. So I have a look at the retina and the back of the eye, and we recheck the script once you're dilated, because it's important to check that the script is relatively stable even post-dilation. And then we talk about the options for the patient based on their occupation and their personality. So it's a little bit more customized. So really the initial assessment is to see whether or not you're a candidate for laser. But we still have patients that come in and they're not a candidate for laser, but then they want to go on to see me for implantable collamer lenses or ICLs. So just because you're not a candidate for laser with the optometrist assessment, it's just a screening. It's basically a screening assessment to give you a ballpark idea of what you may or may not be a candidate for. I've definitely seen patients that have seen the optometrist. The optometrist has said, you may be a candidate for SMILE. And I've said, actually, I think it's better to do ICL, and vice versa. Because again, I have to emphasize it's a screening assessment, but really, the more thorough assessment is obviously done with me, which is the paid assessment. And, that's because I have to use my expertise to go through all the different factors and put it all together. I think the initial assessment is fantastic because it gives patients an idea of, oh no, so I'm not a candidate for laser. I'm not really interested in ICLs at this time. I might leave it. Or, oh, I'm not a candidate for SMILE, but I actually really, that's cool. I didn't know about ICLs. Let's do that. Or I'm a candidate for SMILE and I'm going to go and see the doctor now because I want to book my SMILE in as soon as possible.
Right.
So it just depends. Like there's all the different scenarios, but it just gives patients also an opportunity to not feel obligated. Like they can just ask questions, get a general check of their eyes and see if they're suitable, but they don't have to feel like they have to go ahead, because it's a big decision and it usually requires some thought and some time. I have lots of patients that see me and then a year later they come back and they say, I'm ready to go ahead now.
Right.
It's a decision that usually takes a bit of time, and we appreciate that at Eagle Eyes. And I don't want my patients to feel rushed. I want people to go in knowing everything they need to know, ask all the questions before the surgery. We see them multiple times on different days. So we see them, usually the optometrist sees them on one day, I see them on another day, and then they have surgery on another day. So they've usually had like 2 or 3 visits before the surgery. We check the script again, day of surgery. We're pretty thorough. And I think patients really appreciate the fact that, they've had a number of opportunities to see us, to ask questions. Nothing's rushed. It's a really important decision. Eye surgery, I totally recognize that. We take it super seriously, and I think that's what works for us at our clinic.
You mentioned a piece of equipment before. I think you still call it a pentagraph. Is that right?
Pentacam.
Okay,
Yeah.
that's close. And I think I've heard some optometrists say to me in the past, like that's on their bucket list of of equipment that they would love to have. So I gather it's quite a advanced piece of equipment that not every suburban optometrist may necessarily have. Is that right?
So the majority of optometrists probably don't have pentacams. There are some specialized optometry clinics that may, but the majority, I can say, would not. It's very much a specialized piece of equipment, usually in an ophthalmology setting. We don't just use that for laser eye surgery. I use that for my keratoconus patients to track how they're doing with their keratoconus. After cross-linking, I use it for monitoring. So it's a very specific device, quite very high technology. We have that, but we're also lucky to have an MS-39, which I can tell you, I'm pretty sure no optometry clinic will have. So we really do have the latest technology here, and that allows us to make the best decisions for our patients and to get information from a number of different devices and average that information, because, you never want to just put all your eggs in one basket. You don't want to rely on one machine. So we have a number of different devices, and then we obviously use our clinical skills. We have a number of refractive surgeons here at Eagle Eyes. We have myself, we have Dr. Lee, we have Dr. Zhang, and we've got Dr. Gulam as well. So between us, we're all highly trained. Most of us have all done fellowships. I mean, I did a fellowship in Toronto for 2 years in refractive surgery. I'm also a fellow of the World Congress of Refractive Surgery and Visual Sciences. So we have a lot of experience, and we use that to make the best decisions along with our equipment and along with our team. So kind of everything together we use to get the best results for our patients.
So that initial consultation that a patient has with your optometrist is free, I believe. Is that right?
Correct. That's right.
So given that you do have all of this advanced equipment and expertise and experience, would you say there's a good argument when somebody's looking at that initial step of whether or not they're a good candidate? Is there a good argument to say that they should be coming to a clinic like yourself at Eagle Eye rather than asking their own local optometrist, whoever that may be?
I mean, most of the time, it's still good to ask their local optometrist, because collaborative care. So it's still good to ask their local optometrist, is my script stable? Do you think my script would be suitable? Because the optometrists that refer to us really know their patients. They know their general eye health. So, I get a lot of referrals from optometrists that already have listed out, this patient has this script from these years. They use the contact lenses this often. They're a glaucoma suspect, but they don't currently have glaucoma. They kind of list everything out. And so I think that they're the best person to actually initially ask, but they still don't necessarily have all the information that you need to make an actual informed decision. And that's why we offer these free assessments, so the patients can do that. And there's no obligation. Like, you can come in, have all the scans for free, and then, as I said, I have plenty of patients that have seen the optometrist, and then a year later they'll come back and book in with me because they've decided now's the time financially, now's the time with their work. Like, life gets in the way, people are going away. I like my patients to be around usually for a little bit of time after the surgery, just to monitor them and make sure that everything's going well. So there's so many factors that come into play. But I think it's collaborative. Like, lots of patients that see me from out of Sydney. So I get patients from rural New South Wales. I've had a few interstate patients, which is lovely. So those patients lots of them will follow up with their optometrist. So it's really important that there's the lines of communication are open, and that we're all aware of what's going on with our patients.
Yeah. All right. Thank you. Well, Erica, so as always, it's been a really clear and informative and practical explanation of LASIK and how suitability is determined. Do you have any final words of advice for somebody who's thinking of LASIK but isn't sure if they qualify?
Look, I think the initial plunge is a bit scary, but I think we try and make that nice and easy for our patients. So you don't have to commit even to a doctor initially. You can just see our really, really highly trained optometrists, see if you're a candidate. We give you some information to go home and read. Pretty sure there's a video where I'm saying some stuff as well. So you can do all of that at home, and then when you're ready, you can come in and see the doctor and take the plunge if you're ready for it. I think it shouldn't be rushed. You should feel really comfortable with your surgeon. We're also welcome second opinions. So if you go, there's lots of clinics around that, also offer a similar service. And I think that it's important to feel comfortable with your surgeon, feel comfortable with the clinic and the equipment and where you're going to have the surgery. So all our patients, when they come in, they see our laser suite. They're familiar with the clinic. They've already met our staff. By the time surgery comes around, they already kind of know everyone and they feel really comfortable. And I think that's important. So that's the main things I take home. And then I think also be open-minded. If we say you're not a candidate for LASIK, you might find that you're a candidate for ICL, and ICL is a fantastic procedure. We're doing a lot more of them. I think globally, a lot more are happening as well, because it's a great option where we're not removing tissue as well. So there's definitely some advantages as well. So I think be open-minded and and just take the plunge.